Hi there, Dr. Pieter Troost here. I'm a specialist ENT surgeon. I've been in practice for many years doing general ENT surgery, but specifically also focusing on chronic sinus problems and how to manage and improve the patient's quality of life by treating these problems. So chronic sinusitis is a very common condition in our society. It is linked to allergic rhinitis or hay fever, which often leads to sinus problems, but there are multiple other reasons why somebody will also experience chronic sinus problems. And chronic sinusitis is a pressure on the face and the facial area, that's where the sinuses are located, and you experience a pressure there. There's sometimes a runny nose, a discharge of the nose. The patients complain of headaches, and they have a multitude of other problems, but those are the most common things that people will come and see me about. This often happens after upper respiratory tract infection, or sometimes it's just a continuous situation that the patients have to endure. So this is not necessary. We can solve this and improve the quality of our patients' lives tremendously. So when the patient comes and see me, we examine them endoscopically. That means with a little telescope, we look into the nose, look at the sinus drainage areas. We obviously examine the whole ENT system, because sinuses can also impact on the ears and cause ear problems, a postnasal drip with some chronic cough and a coughing problem. But anyway, so we look at the patient clinically, we examine them with the little telescope as I mentioned. We then usually send them for two types of tests. The one is to do a CT scan of the sinuses, so we can look at the sinus cavities which are situated around the face. We can very clearly see that on a CT scan nowadays. And secondly, we send them for an allergy profile to look at the possibility of allergy being part of this problem. So then the patient returns to me, we look at them again, we look at the test, and we give the patient a management program. How are we going to solve this problem? That sometimes involves surgery by draining the sinuses, washing them out, straightening the nasal septum, removing nasal polyps, lots of conditions that have to be sometimes looked at by surgery. We also then look at the allergy situation. If there's an allergy problem, we also give allergy management. By doing these two things, the surgery sometimes as indicated and the allergy management, we can go a long way in relieving the patient's chronic sinus problems and therefore also improve their quality of life.